Mentioned that I stayed in Kilmarnock, south of Glasgow, in 1992 for 6 weeks at Crosshouse Hospital as a medical student. It was quite some time there. Well, coming back to 2018, well, the trifecta pericardial valve, that's what I've been asked to talk about. If you look at the hemodynamics at rest, and there's numerous paper out there, but let me just concentrate on two. There's this one paper from Tristan Jan, who's a well-known surgeon, and he did a meta-analysis in 2015 where they looked at approximately 1,000 patients and looking at a few studies there. They looked at 13 studies dealing with the trifecta heart valve, and what they were able to see is that if this is preoperatively, this is postoperative values for effective orifice area index as well as gradients, and for all the valve sizes, 19 all the way to 27, some excellent data when it comes to reduction of gradients postoperatively and increase of effective orifice area index. Even for the 19 millimeter valve, you almost have a one-digit number when it comes to mean gradients. A year later, this data was published by Chef and his group, and they looked at their midterm results over 6 years' time, and in these data there is included the very first patients from 2007 from Bavaria and his groups and others, and what they were able to show is, again, good gradients for all the sizes. 90 millimeter valve sizes are up here, 27 is down here. So mean gradient values excellent over a period of time of 6 years, hardly any increase. Large effective orifice area with hardly any decrease. And if you look at structural valve deterioration over those 6 years, some excellent 97.3 free of structural valve disease. So some very good results when it comes to observation at rest, but that's not everyday life. This is what happens every day, and this is what happens every day. So we walk, we have sports. Golfing has 75 watts, didn't know that. And so we believe, and others also believe, that we should test those valves under exercise conditions. And in 2012, we came up with the idea of having a study where we put the patients on a supine exercise stress test with a stepwise increase of 25 watts per minute to a maximum of 100 watts, which equals 2 stairway steps at a time. And then we also looked for the 10 minutes post-exercise recovery period. And we did that with a continuous transthoracic echocardiography and blood pressure measurements and ECG measurements recordings over time. And we had 37 patients in the trifecta group, 39 patients in a historical group, that was the Medtronic freestyle. We had 49 patients, Ross patients, and 25 healthy patients. Mean valve size was 23. If you look at the mean pressure gradient development during exercise, you can see that there is an increase for all the groups of the gradient till 100 watts, to the maximum exercise. And the healthy patients do the best, but if you look here, the green ones are the trifecta, the red ones are the stentless groups. And here there's a significant difference between trifecta and stentless groups, better values for the trifecta. This is very much interesting, I believe, and this is the percentage of patients with a complete DP recovery over the 10 minutes recovery time. And what you can see is that the trifecta group, 80% of patients recover in those 10 minutes, but for the Medtronic patients, it's only about 60% of time. So again, better values for the trifecta group. If you look at effective orifice area index, and I see Torsten Döns here, he has some own opinions about effective orifice area index measurements during exercise. But what you can see is that for the trifecta, and that was very much astonishing, is you can see an increase during exercise of a stented valve, which we didn't understand in the first time. Why is it that the valve opens more during exercise? Maybe it's because of the stent design, and Dr. Szymanski will talk about that a little bit further on. And so that was the only stented valve with the ability to improve its EOAI. But the study had some limitations. It was a non-randomization protocol. We had a heterogenic study group. We had different follow-up time, and the And we had a lack of comparison with other modern pericardial bioprostheses, that is, for example, the Edwards Magna or Magna Ease. Well, then the French group came up with a story, and I'll just skip this because one of the authors is here and we'll talk about it. We then took our heart valves to the mock circulation, and we compared the Trifecta versus the Magna Ease. And we then calculated the gradients. We calculated the geometrical orifice area with a certain computer program. And what you can see for the valve size 23, Trifecta versus Magna Ease, you can see that there's a significant difference from 4.5 liters per minute on. That means less or lower gradients for the Trifecta at exercise in the mock circulation. And even for the 21 millimeter size, we have a significant difference right away from the start of our measurements. If you look at effective orifice area index in that in vitro measurement, you can see that the Trifecta has significantly larger EOAIs for the 23 and also for the 21. If you look at with a high-speed camera onto the valves, on the left you have the Edwards Magna Ease at 7.5 liters per minute, and you can see a nice opening here. But for the Trifecta, you can then see a larger opening, and we believe that is due to the design of the valve, which is that the pericardium is mounted on the outside of the leaflets. And when you calculate that, you can see that for the Trifecta, you have an increase of EOAI of 24% in comparison to 1.9 for the other valve. So then 2 years later, Bach came up also with an exercise test, and they were comparing the freestyle again, the Magna Ease and the Trifecta. They didn't see any difference between the freestyle and the Trifecta when it comes to gradients, but the Trifecta did significantly better than the Magna Ease during exercise to a maximum of 75 watts. And we then were able to publish our data last year with an emphasis on the small valve sizes and comparing the Edwards Magna Ease to the Trifecta with the same protocol that we have had in 2013. And we were able to see that for the effective orifice area index, the values for the Trifecta are significantly better than for the Magna Ease. And when it comes to mean transvalvular gradient development, again, better numbers for the Trifecta heart valve. Well, if you then use the VARC-2 criteria for prosthetic valve dysfunction, and this is the definition of the VARC-2 criteria, which is severe, moderate, or no PPM, you can see that at rest for the Magna Ease patients, approximately only 38% of the patients had no PPM. Some had a moderate PPM, and also approximately 20% had severe PPM. And if you put these patients on exercise, you can then see that for the Trifecta, the VARC criteria change from orange to green, which means there is a reserve in an opening capacity, or there seems to be a reserve for an opening capacity for the Trifecta heart valve. So I'd like to conclude that in my belief, the Trifecta heart valve offers excellent hemodynamics at rest. During moderate exercise, the Trifecta heart valve reveals a nearly physiological hemodynamic behavior. And the post-exercise hemodynamic recovery of that Trifecta heart valve equals to that of a healthy control group. And especially in small heart valve sizes, the Trifecta heart valve hemodynamics are significantly superior to competitors in the market. Thank you very much.